Good day everyone, this is Zxiakira C. Prodigalidad from Nursing 216 and I am here to discuss and demonstrate donning and removing the gloves using open method. So we are doing this procedure in order to prevent or avoid the client to be at risk of contamination or infection in the healthcare environment and sterile gloves or nurses' hands. We are also doing this procedure in order to prevent the spreading of microorganisms that is found in the healthcare environment or the nurse's hands or also in the patient's. So the first thing we have to do is to review the records and orders of the patient to determine what procedure is to be done using sterile gloves. By reviewing the records of the patient, we will also know if they had any allergies to latex gloves, so that we would know if we have to change to a non-latex gloves later. We also have to think through the procedure before doing it and also have a spare gloves with us so that we won't have to go back and forth from the ward and outside. And also we have to wash our hands or do the hand washing procedure and check all the materials or prepare all the materials needed in the procedure. So prior to the procedure, we also have to check the sterility of the gloves and the package, and also follow our nursing protocol, which is we have to introduce ourselves to our patient, verify the patient or know the patient. We also have to explain why we are doing this procedure, what it is, and why is it done, and also what is the purposes of doing the procedure of donning and removing the gloves. So first, we have to make sure that we already wash our hands or did the hand washing procedure before going to this process, and also we have to prepare all the materials, and in this procedure we use the gloves or surgical gloves, and we also have to check the sterility of the gloves. So as we can see here in its name, sterile latex surgical gloves. So it is sterile, and by that we have to start by peeling off the outer glove package carefully. And we have to place this package on a clean, dry surface. And then we have to grasp the inner package and lay it on a clean surface just above the waist. So as we can see, it's just above the waist. And we have to keep the gloves on the wrapper. Next is we have to here we have to use our 2 fingers to remove this package, and as we can see, we can now see the gloves, and we have to make sure to only touch the sides of this package because this part is already sterile and this part is unsterile, so we can touch it. There. So we can now see the sterile glove, so we can now start the procedure. So first is we have to glove our dominant hand. So in this case, our dominant hand is our right hand, so we have to glove it first. With our 2 fingers, we can touch this part because this part is non-sterile, but we can't touch this part because this is sterile. So we can use our 2 fingers and also our thumb to glove our dominant hand. We also have to keep our thumb here so we can slid through easily. have to keep the cups folded here because we have to use that later. So as we can see, we already glove our right hand, so we can now start to glove our left hand. In this part, we have to make sure that we don't touch the non-sterile part with this hand, and also keep our thumb away so we can touch this. We have to slide our fingers inside the sterile part. We also have to keep the thumb here in this part of our hand, so we're going to slide through. So now we already glove both of our hands, and now we can do the removing of the gloves. But before that, we have to remember to interlock our fingers when we are walking so that we can avoid to touch any unsterile part in the healthcare environment, and also to avoid any contamination or infection. So like this. So now we can do the removing of the glove. So first is we have to touch the glove in the upper part and remove it halfway, like this. And then we have to put this here and slowly take our hands then we have to slip again our two fingers inside here and slowly remove the glove. And that's it. We can now dispose this part of the glove in our trash can. So that is all for donning and removing the gloves. So we can now proceed to evaluation. So after this procedure, we have to document all the findings and all the activities we've done, and also the responses of the patient, and also we have to conduct any follow-up so that we will ensure in our next visit that we have enough materials to do this procedure.